Hello, everyone, and welcome to today's COVID-19 office hours. My name is Natalie Matthews, and I'm going to give just a very brief overview of the technology before turning things over to our moderator and speakers for today. So two brief notes about housekeeping for the webinar today. One is that we will absolutely make a recording of today's webinar along with a copy of the slide deck and a copy of all of the questions and comments that come into us today. We will post all of that to the HUD Exchange at the link that I'm putting in the chat right now. We'll do that within 2 to 3 business days, and you can find not only content from today, but all of the previous webinars and office hours at that link. Additionally, if you have any challenges during the course of our time together today with audio, sometimes we've noticed that computer audio can be a little challenging with WebEx. So if you have audio issues, I ask you to please call in via either the 1-800 number or the 415 number that are in the chat box right now for you. And I will, of course, post those throughout the webinar if you have challenges finding them. Also, all attendees will remain muted for the duration of our time together today, but we absolutely want to hear from you all throughout the session. So as you have questions, ideas, feedback, comments, please go ahead and submit them to us through the chat feature in WebEx. If you look on your screen right now, as is shown in the slide, you should see several little icons towards the bottom center of your screen. One of them will look like a chat or a message bubble. If you click on that, it'll open up the chat window for you. When you're sending in those questions or comments, please go ahead and make sure that you are sending them to all participants, and that will ensure that they go to not only the attendees, but to the presenters as well. And with that, I'm going to now turn things over to Norm Suchar from HUD's Office of Special Needs Assistance Programs. Norm?
Thank you very much, Natalie, and welcome everyone to the Office Hours webinar today. I want to quickly introduce our presenters and various resource people that will be on the call today. So you have from the SNAPS office, you have myself. You'll also be hearing from Brett Esters and Marlisa Grogan and Ebony Rankin. We have a special guest from HUD, Todd Richardson from the Office of Policy Development and Research. We'll be talking about the second allocation formula for ESG that went out this week. Jesse Hanforth-Combe from the Office of Block Grant Assistance will give us a little primer on duplication of benefits issues with respect to CDBG. And then Aaron Weaver is a CPD representative from our Chicago field office and will help walk us through some of the latest information about the mega waiver. So moving on to the next slide, please. So I want to quickly give some HUD updates. Next slide, please. So as I mentioned, on Tuesday of this week, we announced $2.96 billion in ESG funding. That was the second allocation of CARES Act funding. We developed a brand new formula for these awards. Todd is going to talk about that formula and exactly what's behind it and what the factors are and all that. We do have the methodology discussion of the formula posted on the website. The link is here in the slide. We'll also post it in the chat box. The first allocation of ESG funding was just based on the regular ESG formula that we use every year, but Congress instructed us to use a different formula based on a variety of factors for that second allocation. So we do have two different allocations, two different formulas for those allocations, which is why you might have gotten more or less than you might have expected. Moving on to the next slide, please. So with that, I'm going to introduce Todd Richardson from our Office of Policy Development and Research. And he's going to walk us through that second formula and the factors and some sort of considerations with respect to that formula. So Todd, the floor is all yours.
Thank you, Norm. Okay, so next slide, please. All right, so this slide has the exact statutory language we were provided for how we should target this second allocation of the ESG CARES Act funding. I've parsed it out a little bit in the way we parsed it out to think about how the allocation works. So it's very clear that Congress wanted us to target this at unsheltered homeless, sheltered homeless, and those at risk of homelessness. They also emphasized that we should look at additional factors such as risk of transmission of coronavirus, high numbers or rates of sheltered and unsheltered homeless, and economic and housing market conditions as determined by the Secretary. So on the issue, and this came up in the chat box, on the risk of transmission of coronavirus, so when this CARES Act was being written, it was not clear at the time how widely the coronavirus was going to spread and how it was going to spread. But it was assumed that in communities where there is coronavirus, that homeless community would be particularly affected, particularly the folks in congregate shelters and unsheltered homeless. So for the purpose of the formula, because we learned after several weeks of following this that the coronavirus is in fact in every state, in every community, and it has increased and gone down in some places, it continues to go up in other places, that we concluded that given the virus is in every state and it has these different trajectories, that by targeting the homeless, who is a high-risk group, we are also targeting to the risk of transmission of coronavirus without actually using any of the coronavirus data, which changes pretty significantly every day. Finally, one note on the economic and housing market conditions. What we looked at there is that the cost to provide housing for homeless was going to be more costly in places with higher rents. So our formula takes that into account as well. So next slide is the actual variables and weight. So fortunately, we have the point in time count data from 2019. And while we might not always use that in a standard formula, in this case, it made a lot of sense. We have the data. We want to target the homeless. So we put 50% of the weight, which means 50% of the funding is being allocated based on each community's share of homeless. That is, your count of homeless divided by the national count of all homeless is 50% of the money. For unsheltered homeless, which is also part of the total homeless count, we provide an additional 10% of funding. While we recognize this is a double counting a bit, we also see that Congress listed unsheltered first on their list of things to target, and we also assume the cost for addressing unsheltered homeless would be higher. At risk for homelessness is a bit more interesting. In the CARES Act, the definition for at risk for homeless was expanded to very low income renters, and so we use that as the variable here as very low income renters. Now, just doing correlation analysis, we can see your rate of homelessness in a particular community correlates pretty well with places that have high rates of very low income renters. And we can expect with high unemployment that very low income renters will be the ones that are hit hardest and have the greatest risk of homelessness as we proceed through this crisis. So we've allocated 15% of the funds on that. A narrower group of VLI renters, however, correlates well with unsheltered homeless, and that's very low-income renters that are overcrowded. The variable we have from census is overcrowded or without kitchen or plumbing, but mainly this is very low-income renters who are overcrowded. That correlates at 0.562, so it has a high correlation with unsheltered homeless. So that also is a factor that we've used here with 25% weight. And as I noted earlier, we use fair market rents, one-bedroom fair market rent. And if your community's one-bedroom fair market rent is greater than the national weighted average for one-bedroom fair market rents, we'll adjust each of your counts up to increase your the share you're getting up to 20% more based on how much higher your rents are than the national average. And that's the formula. So next slide. So one thing obviously we want to check is we want to check and see, okay, we've got all this data, we put this together. So if we compared the per capita allocation, so the per capita grant amounts of the formula, the formula per capita, to each of the rates of homelessness, overall homelessness, sheltered homeless, unsheltered homeless, these other variables, does it still target well to those rates? So places with higher rates of homelessness, does it target well to those? And because these are the variables that we've used in the formula, it does. It's extremely good at targeting to where there's homelessness in the country. So I'm available for questions.
Thank you very much, Todd. And just want to let everyone know that Todd's going to be on for questions now. So if you have any questions about the formula, now's the time to post and get those ready. So Todd, just one question I wanted to ask about because I know there's a lot of interest in using the COVID data. I know you did some assessment of sort of the quality and timing of COVID data, and trying to figure out whether there was something usable there. Can you talk about what you found about sort of the data quality there with COVID spread as it related to homelessness and the timing of that and the challenges of trying to use that as a formula factor?
Sure. So early on, there really wasn't, when CARES Act was first funded, there actually really wasn't a lot of data on COVID infections and COVID infection rates. We were using these models of various places to sort of like what are the likely trajectory is, how much will places go up. And as we looked at all of the different models that were available, what was very striking is all of the models gave very different answers. And if you looked at a model from one day to the next, it would be very different. So we realized the models were not going to be able to be useful in this time frame to know how to allocate these funds or think about how to allocate these funds. And then the data started to come in, and we started to get more data, and we started to get data at the county level, and it was also coming in, and it was changing on a daily basis as well in a way that was very hard to predict. So we want to allocate this money is for a longer term. And so realizing that the trajectories were different for different communities, that communities were reporting the COVID case counts differently, and also realizing that it was everywhere. I mean, that was the big finding is that this was everywhere. That the key was that every community was going to have to spend the money to address the potential transmission of COVID in the homeless community. So we would just allocate on homelessness, and in doing so, we would be also targeting to those that most at risk for transmission of coronavirus.
Thanks. And we have another question about why didn't we use the original ESG formula, or I guess it's the current ESG formula? I know you did a lot of analysis about the correlation between the ESG formula and homelessness, and what did you find there? So
you see this chart on the screen right now about this formula targeting the homeless rate per capita at 0.941. Well, the current ESG formula, which is based on the CDBG formula, has a correlation of about 300, 0.3. And that's because it has a couple of variables that are good. Poverty and overcrowding are good targeting, but it also has a lot of variables that are completely unrelated to homeless needs. It's got pre-1940 housing. It's got your population loss. In fact, because of the population variable, there's the current ESG formula has zero targeting to unsheltered homeless. There is absolutely no relationship between the current CDBG form or the current ESG formula and unsheltered homeless. So it is not a formula that targets well the homeless need. And while that may be okay when you're allocating $300 million a year, if you're going to allocate $4 billion, you might want to get it targeted to where the homeless counts are the greatest.
Great. Thank you so much, Todd, and thank you for joining us and walking us through the formula and some of the more sort of wonky parts of it and some of that data. Appreciate that very much. So we're going to move on, and we're going to next turn to Marlisa Grogan from the SNAP's office, and she's going to talk about next steps for accessing ESG funds. Marlisa?
Hi, everybody. Now that the second allocation is out, we want to just reinforce the fact that it's time to get your substantial amendments in and start the process for the immediate next steps for accessing your ESG CV funds. So if you've not yet submitted your amendment for round 1, now's the time to do it. You do have some flexibility in the way you approach your substantial amendment submission. You can include both rounds 1 and 2 if your planning process has already concluded for round 2, or you could still do them sequentially, starting with your round 1 submission and then following it up with an additional amendment to incorporate your round 2 funds. But the important thing is don't wait. We want to acknowledge that, there is, I think, a lot of uncertainty being felt by recipients, and that's understandable since the ESG CV notice hasn't been published yet, but there are a number of costs that you absolutely can plan to, you can expect to plan for, such as rehousing for program participants that are transitioning from shelter or unsheltered situations to permanent housing. So what I'd like to get at is just to clarify the level of basically the scope of your project description for your amendment. We linked to it here, and we'll also put it in the chat, the guide for, or the instructions for setting up a substantial amendment for CARES Act funding in IDIS. That guide describes how ESG projects should be set up, and it indicates there that we're just looking for a high-level summary of all eligible activities that you're going to be funding in response to COVID. So that means that we're looking for a component-level description. So we want to hear if you're funding emergency shelter, street outreach, rapid rehousing, homelessness prevention, or HMIS, but we're not expecting to necessarily see subrecipients that you've selected for an award or dollar amounts that you're going to be subawarding. That's not required at this point, that level of specificity. And it's also a great idea to provide yourself flexibility to adjust your funding decisions as you're going through your COVID response. There are acceptable ways to do that in your project description so that, as you reevaluate and recalibrate your COVID response over time, you can shift funding as necessary, and including contingency language such as something to the effect of, as we, 6 months into our COVID response, as we reevaluate the progress of preventing COVID infections, the recipient may or has the discretion to shift funding from X component to Y component, those types of things. If you have any ideas that you'd like to run by us, feel free to keep in touch with your field office or submit an AAQ. But we also just want to reiterate the point that if you feel like you need to wait for the notice in order to start even using your round 1 funding, it's nice to have the notice, but there are things that you can use ESG for in the immediate term, which is the intent of round 1 funding to rapidly respond to COVID. And certainly any sort of funds needed to decompress shelters so that you can do social distancing, setting up non-congregate sheltering options in partnership with your emergency management officials and public health, as well as making sure that you have rehousing options in place to make sure that people who are living in non-congregate shelter are not moving back into congregate or unsheltered settings. So these are things that you can do now, and bottom line is don't wait. With that, I'm going to turn it back to you, Norm.
Thanks so much, Marlisa. We have a discussion about the mega waivers queued up, but before we do that, I'm pleased to welcome Jesse Hanforth-Cohn from our Office of Block Grant Assistance here. We have been getting a lot of questions about duplication of benefits and the interplay between ESG and the CDBG program. So we invited Jesse on to talk us through some of that. So Jesse, I'll turn things over to you.
Thank you, Norm. I'm happy to be able to jump on here. I am not going to bring slides because we're still in the process of clearing the CDBG CV notice as well, where we're going to have some of the duplication of benefits guidance. And we've also queued up some technical assistance that's going to be coming. But, you know, just starting at the beginning, duplication of benefits happens when there's financial assistance going to a beneficiary, an entity. In ESG, it would be a subrecipient, but in CDBG, you could also have a business or developer, and you're trying to address losses resulting from the pandemic or costs, allowable costs of eligible activities for preparing, preventing, and responding to the pandemic. And a person gets or reasonably will receive financial assistance for the same cost from any other source. And they mean it, any other federal, state, local insurance proceeds. And the total amount received exceeds the total need for funds. And when you define it like that, the requirement that you're going to be seeing to deal with duplication of benefits is going to say that as a grantee, and the grantees will pass on to subrecipients, that you're going to have policies and procedures to try to prevent duplications of benefits. And you're going to do it by figuring out what the needs are for what you're funding. And it's not a super arcane, heavy-duty analysis. For most activities, you're going to say, you know, there is a need for non-congregate care in this amount. We've identified this on the ESG side. We know what we need, and assemble your funding sources. And I come from the economic development world, actually. I'm one of the few non-housers at HUD. And so I would say you're putting together your sources and uses statement, and you don't want to pay for anything twice. So you put together your need, and you start building the sources of your funds and how you're going to use them. And some of the sources are going to be constrained. Like from CDBG CV's point of view, ESG is constrained to a smaller list of eligible activities that mostly overlap CDBG. So when you take a block grant like that and a block grant like CDBG with so many more categories, those funds aren't available until you budget them or the grantee budgets them for something. At that point, they are reasonably available. And so you have to say, okay, is there any insurance available for this activity? Insurance is the one everybody forgets to check for. Are there any reserves? You know, should the landlord of a place have been able to cover shortfalls or particular costs that they need from their reserves? In many places, landlords probably can cover some like additional safety costs and things from their running reserves, and they should. That's what reserves are for. It varies by state law, so I can't like opine, and that's one of the things we're kind of carving our way around as local requirements. And then you say, okay, well, we've decided to spend our ESG funds, you know, on this split of the eligible activities for ESG. Here's the one that we don't have enough to cover the needs we've identified, and we want to use CDBG CV in addition. Or it may work the other way. We've decided to spend CDBG on this cost, and we're going to add ESG to the activity because there's more need. But you're always having policies and procedures to say, what's the need, what are the funding sources, and how are we going to use the funds? Now, one of the things that's different from a sources and uses statement in an economic development sense or even a housing development sense is that you're also having to look at time, because one of the potentially duplicating sources of funds is the FEMA Emergency Protective Services public assistance money. And so FEMA maybe is paying for, I think we've looked at some things, Norma, where they were paying for some of the non-congregate care costs for maybe 60 days. And then they weren't going to be there anymore. And so the need that continues is actually need further out in time. They might have covered all your costs for 60 days, but then they suddenly are gone. Then you have a problem in time. And, you know, you have to decide which program and what sources are going to plug in that time frame. And that brings you to more of what is normally called a pro forma. And the reason I'm telling you this is there's actually software you can download that'll help you with. A pro forma will run you over like a 1 or 2 year period monthly, and you can parse out where things fit time-wise for both sources and uses of funds. And that can really help you understand how everything is going to slot together, and it could serve as your policy and procedure for documenting how you're preventing duplication of benefits. So there's a number of shortcuts. You have to have a written statement of policies and procedures and SOP for how you're going to check. And you might have to have a different one for your economic development program with CDBG CV than you have with your shelter or non-congregate care or public services, where ESG and CDBG might overlap. And then you just document that you've worked that, whether it's a checklist or you're going to use some software that shows how the costs fit in over time against the needs. That's the sort of thing. It's just super, super practical. And if you're running a little relatively simple program, maybe your SOPs are relatively simple. It may be that you have no other sources of funding available to you at all besides CDBG and ESG for this, but a lot of places are also going to have to contend with this FEMA funding that could overlap. And all of these things, also Treasury funding is possible if you got that for 171 local governments, states and local governments, and counties, I think. You want to look, these are all block grant sources, which is unusual. So there's a ton of guidance on duplication of benefits out for CDBG disaster recovery, and it's on the HUD Exchange, and you can look at it. But it's in an environment where there aren't so many block grants in play, where you don't have to have these decisions made in order to make the funds available, because available is like a term of art almost in this. And then the other thing they assume on the disaster recovery side that's not really in play over here, and this is where the policy is evolving, is around order of assistance. In disaster recovery, Congress usually says who has to go first. So it says that in a typical time, they'll say CDBG cannot be used to pay the things that FEMA and SBA pay for. They left that language out. It's still in one of the underlying statutes, but they didn't reinforce it in our part of the CARES Act for CDBG CV, and that's one of the areas that's a little unsure. But I think that what you can rely on is that it's really, really, really important to be strategic, to deliberately make decisions and set policies and procedures, and just be reasonably careful with the money. A reasonable person standard is what we're looking for, that you're not clearly, oh, we just got up this morning and decided to put this money over here and no, we didn't check. That would be bad, right? So we're looking for you taking just reasonable fiduciary care of the money, and we're going to get more guidance out. The other really big thing we're hearing is that because so many of the funding sources in the pandemic response are new to the disaster or emergency world, there's a lot of people who have no idea what CDBG or ESG do. They don't know what you can fund versus what they can fund. They don't have the lingo. They don't know what, we're not communicating really well. We're discovering we're using the same words for things that, like reimburse, CDBG means something different than everybody else, I'm just telling you. So one of the TA products we're going to bring for CDBG is one that you could take to a partner and say, these are the things that CDBG can fund, in English. And here are the considerations, and here's a link you can click through to get a little more information, a little mini video or something like that. Because there's nobody else in play right now that can pay for public services and housing and public facilities and improvement and economic development, you know, and planning. And so, you know, it's a lot like that story of how do you describe an elephant if you've got a blindfold on, you know, and you just touch the trunk or the tail or the shoulder, you don't know, you can't. And we have a lot of grantees saying they're having a hard time explaining CDBG to their partners so that they can work together to understand duplication of benefits. And that's the really key thing, right? If you think somebody might have money, HHS or you know, ESG or insurance that might overlap, you need to go ask, have a conversation and figure out whether it's totally out of the picture, and then just document that. There's no way that you overlap. That's the best answer, right? Or that you do overlap, work out a protocol, put it in your SOP, and just follow it. You know, and the main message is really, really be strategic. Only overlap federal programs if they're fairly compatible and won't bring you a whole lot of extra paperwork with them. And HUD and CDBG and ESG can work together fairly well. We have experience there.
So I just want to sort of ask a couple examples. I know you went into a lot of detail there, and I know we also have a lot of people on the call who probably not as familiar with this. So to be clear, these are analyses that are being done by the CDBG recipient. This isn't something you're doing as a sub-recipient of ESG funds.
It's true in the entitlement side of the program. The state might pass it through to a subrecipient or grant recipient. And if you are a subrecipient, you are going to be asked by the grant recipient. You need to be aware they're going to make you tell them things that maybe they aren't always asking about what other funds you might have available and what needs you can see. That might be part of a grantee's procedures and how it's going to affect you. You're going to be like, why are they pestering me for all this extra information? We've never done this before. And it's going to be because they're trying to follow up on this duplication of benefits to show, essentially you're trying to show a negative, and that always takes more paper than trying to show a positive. It's been my experience.
So, and we had a couple people who wanted to sort of follow up on a couple sort of examples of using CDBG in the context of other things. So one is on non-congregate sheltering. You used that as an example. So FEMA, and I think just sort of on the FEMA side, I will say we are working on some guidance that will come out soon about sort of what you can expect as far as the interplay of FEMA and CDBG and ESG funding. But the basic concept around duplication of benefits here is that if FEMA is paying for a hotel room, CDBG is not paying for the same hotel room at the same time, right? That's obviously a problem.
Right.
Same with ESG. But if FEMA is paying for, you know, a hotel project for 60, 90, 120 days, however long they end up paying for it, outside of that window, right, you could use CDBG to pay for hotel stays. Or if there's a different target population, say FEMA is not serving people who, I don't know, who are like shelter caseworkers or something like that, who aren't experiencing homelessness but who need protective measures for another reason. Maybe FEMA's not paying for that. You could use CDBG for a different population, different time frame,
Right.
and it's the mixing there that's the problem.
Right. And when you have like identified a need, right? You have a need for sheltering a particular population, and you maybe have an up to income limit. CDBGs is above that. So maybe you're going to say your total program design is actually going to have to cover both programs or all the programs in play, instead of just saying we're charging this population to CDBG, when the CDBG monitors are going to come and say, well, how do we know that there wasn't something else for that? You said, well, we used the something else for this. So you kind of have to use both. It causes our application to overlap a little. You can do one duplication of benefits analysis for a program with mixed funding and use that same duplication of benefits analysis for all of the programs involved.
Great.
Funding sources.
Great. Well, thank you very much, Jesse. I definitely appreciate your jumping on and giving us a primer on that. And You mentioned that guidance is coming out sometime soon, and so I know everyone will be interested in seeing that more detailed guidance. So thank you so much.
Thank you.
Next, we are going to have a discussion of some of the waivers that we previously talked about on calls, but really didn't get to dive into that much. So we have Aaron Weaver and Brad Esters, Aaron from the Chicago CPD Field Office and Brett from the SNAPS office. They're going to walk through the waivers and give us a little more discussion about what they mean, how to use them, and all the interesting ins and outs of those waivers. So I'm going to turn things over to Aaron. The floor is all yours.
Thank you, Norm. So everyone, today we're just going to go over the waiver that was issued on May 22nd, 2020. There you will see that there are some references to the prior mega waiver, which was issued on April 1st of this year. But the one we're focusing on right now is the one issued May 22nd. If you pull that up from HUD Exchange, it covered the Continuum of Care Program, Youth Homelessness Demonstration Program, Emergency Solutions Grants, and housing opportunities for persons with AIDS. The effective date is May 22nd, and as with the prior waiver, it focuses on facilitating assistance to eligible communities affected by COVID-19. Next slide, please. So luckily, the process for notifying us of your use of those waivers is the exact same as it was for the very first one. We didn't reinvent the wheel this time. We're just continuing the same process to keep it streamlined and easy for you. So you're going to notify the local HUD field office, the director, whose email is, we have the link for the email addresses that you need to send that to. But you're just notifying them you plan to use it. You wait 2 days, and this applies to all of the waivers except for one. There is one special waiver in this under the COC program that Brett will cover with you, that you don't have to do the 2-day waiting period and notification process. But for all the others, you notify us, wait 2 days, and then you can use the flexibility. And there's a handy dandy little chart there on the slide to kind of outline the different steps. We're going to go over today what you need to use as documentation, what you need to maintain on site, both at the program level and the client level, so that when HUD comes out to monitor you, you can say, I'm perfectly fine here, got this beautiful packet of paper, and we're good to go. So next slide, please. As with the previous, one thing to note, as with the previous mega waiver, you want to make sure you have emergency policies and procedures. These are just a good practice to have them, not only for your use of the first waiver, first mega waiver flexibilities, but also any subsequent ones. So if you note, you're just notifying us of your use, but you still have to maintain documentation, and those policies and procedures should outline that process. Here's some helpful links for you that will be available. I believe they're in the chat bar as well. Next slide, please. So I'm going to cover the Emergency Solutions Grant section of the notice. Next slide, please, or of the memo. So with the ESG program, the first thing to note is that all of the flexibilities outlined in the very first mega waiver that was issued on April 1st now apply to CARES Act funds. I know that this has been a common question from grantees. Can I use those flexibilities with my CARES Act dollars? Now the waivers apply across the board, so you don't have to worry about that, and also the waiver that is outlined in this memorandum. The second thing to note is that the only separate waiver that's added to this one has to do with housing stability and case management. So next slide, please. As with the previous version of this waiver, program participant, the requirement, right, that you have to meet once per month to provide case management, this is actually waived. It was originally waived for 2 months in the April 1st memorandum. Now we're waiving it for an additional 3 months beginning on the date of the May 22nd memorandum. So for those of you trying to run the numbers, that's August 22nd is when this new waiver will expire. Next slide, please. To document this, you're going to maintain the same information that you did if you utilized this in the first iteration. Documentation of limited staff capacity, shelter-in-place order, or a similar COVID-19 related impediment. A copy of the waiver notification that you sent to HUD. This can just be your email that you sent. And the emergency record-keeping policies and procedures that I mentioned earlier. You want to maintain those. And then in each client file that is affected, you want to put a note in there outlining when you're utilizing the waiver and when that will end. Another thing to note with this, because you may have a situation where a client utilized this flexibility in the first iteration of it from the April 1st memo, and then you're going to use it again, you want to make sure that I want to make sure everybody understands this documentation is in addition to whatever you used the first time. So now that you're using this new waiver, consider it a whole new waiver here, you want to collect that, you want to make sure that that documentation notes, okay, the client's eligibility for this expired on June 1st. We are now applying this one to carry for another 3 months. So it's in addition to, not independent of. I hope that answers everyone's questions. With that, I'm going to hand it off to the fabulous Brett Esders to cover the Continuum Care Program.
Great, thanks, Aaron. Next slide, please. So the May 22nd memo had 4 waivers for the COC program. If we want to go to the next slide. The first one was to extend rapid rehousing assistance. So there's currently a 24-month cap of rental assistance for rapid rehousing. To extend that to an unknown period of time for program participants whose rental assistance was going to end. So they've reached the 24 months beginning May 22nd or any time after, and they lack the resources and support networks to retain housing without additional assistance through the COC program. And they can continue to receive the additional rental assistance for up to 3 months after state or local public health officials have determined that special measures are no longer necessary. So right now it's an unknown period of time, but that time will become more clear as local health officials start opening back up. Next slide, please. So in the case, in your recipient files, you're going to want to include, again, a copy that you notified the field office, your emergency record-keeping policies, and then when we get to the point where local health officials are saying special measures are no longer needed, you're going to want to keep a copy of that in the file so that you know when that 3-month clock starts. At the client level, you're going to want to keep documentation of the number of months they have been provided rental assistance, that note to the file, again, that you requested the mega waiver flexibility. And then you're going to want to keep, the rule right now requires that at least annually you're doing recertification checks that they lack the resources and support networks to retain housing without additional rental assistance. You're going to want to keep continuing to keep those in the file so that you can justify the need to continue to provide assistance. Next slide, please. The next one is a little weedy, so bear with me, but basically for all projects that were funded in 2018 and 2019 as dedicated plus projects, there were like 5 eligibility criteria, right, underneath dedicated plus that you could meet. One of those eligibility criteria was that the person was coming from transitional housing, they were chronic prior to entering, and that transitional housing was being eliminated. But what we were hearing from you all is that as a way to deconcentrate your shelters, you were using open transitional housing beds, and there was no plan to eliminate that transitional housing. But you didn't want to put people there who were chronically homeless because then you didn't want to mess up their eligibility for permanent supportive housing. So this says that this changes that NOFA criteria to say that anyone who was chronic going into transitional housing, whether or not that transitional housing is being eliminated, can continue to be eligible for a dedicated plus project as long as they were chronic prior to entering. Next slide, please. Again, in the case spot or in your
your program files, you're going to want to keep a copy of notifying the field office that you're going to use this waiver and any emergency record-keeping policies and procedures. And then in the client file, you're going to want to keep documentation of eligibility, which is that they were chronic prior to entering the TH project and that you used the waiver. Now, hang on to this for like as long as you're serving the client, and if at any point the client transfers to another permanent supportive housing project, transfer that note that they came in under the waiver to that other transitional house, to the other permanent supportive housing project, because they're going to need it. They may not have requested it, but that person was in fact eligible when they entered. So we'll want to keep that if they do in fact happen to transfer to another PSH project. That question has come into the AAQ. Next slide, please. And this one gets to a lot of your questions that you've been asking over the weeks. Are these grant agreement amendments we're requesting temporary? How are we going to apply next year? Do we have to redo the GIW and then flip it back again? So this says that, oh no, that's not this one. Is it? This one, the requirement, it doesn't match. We're going to have to fix that. The requirement doesn't match the applicability. This one is, it's meant to say that whatever grant agreement you requested between March 31st and October 20th, we're going to treat it as temporary. So when you come in next time into the next competition, you can apply for whatever the grant amount was prior to whatever your line items were prior to requesting that amendment. You can certainly choose to stay with, maybe you weren't doing it as a temporary change, so in that case you can choose to stay that way, but this will make it easier if this really was just a temporary change to get at addressing COVID right now. Next slide, please. So this one, you do not need to notify the HUD field office separately by using that email bank the email addresses. You do not have to do that. The executed grant agreement is sufficient documentation for this waiver. Next slide, please. And then this one is the same as ESG and the same as Mega Waiver 1. So COC had the same issue where the case management for rapid rehousing, the monthly requirement was only waived for 2 months. It was going to expire on May 31st, and we realized that, and we extended it for 3 more months because we are still not out of that time frame where special social distancing measures are in place. Next slide, please. So this matches exactly what Errand talked about for ESG for COC. Next slide, please. And then the last thing that the Mega Waiver did for our programs, it also had some HOPWA waivers, which they covered in a separate webinar. It extended, next slide, it extended the COC waivers from the March 31st memo and this memo that was made available on May 22nd to all projects funded with YHDP funding. So we had received that question. And the same process applies. Contact the field office through the special email boxes. You're just notifying them, and then you can use the waiver 2 days later. I think that's it on the waiver stuff.
Thank you very much, Brett. And we have a bunch of questions. Sorry if you can hear that background noise, but we have a bunch of questions. And I want to send this first one to Marlisa. This is an ESG subrecipient, and their recipient has not released their round 1 funding yet because they're waiting on guidance from HUD or something like that. Is there anything we can do from our end, from the subrecipient's end, to help get money to local projects that are in desperate need?
I would say that one thing that we can clarify is that although it doesn't help if you don't necessarily have the ESG CV funds readily accessible, but advancing funds is allowable under the ESG program. We follow Part 200 requirements. So recipients are able to advance funds. They are able to incur costs using their own local funds and then reimburse those costs with ESG CV. Although again, some people pointed out in the chat that that jurisdictions are experiencing cash flow problems. I would also say that it's really helpful for recipients to be in close contact with their field office so that they're communicating during each step of the process. If they're having any issue in submitting their substantial amendment, we're here to immediately provide guidance, whether at the field office or through the AAQ if you're having any problems following the substantial amendment instructions. And so there's really not a reason to hold back with your round one funding, getting the substantial amendment in, and then as soon as your field office is done reviewing and is able to determine that the review is complete, going to grant agreement. And then once the grant agreement is processed, the recipient has access to those funds. So that's a little bit of a way, some ways that you can sort of use the process.
So, and for people who don't know where Part 200 is or how to sort of follow that guidance, how do people get advanced funding, or how do people find out more about how to get advanced funding? Are there resources out there, or are there sort of a few basic things you can say about like what that process looks like?
Sure. So if you have ESG funds that you already have, and that would also include prior year funds. If you have old ESG funds that haven't been used and you don't necessarily have a plan for them right now, you can contact your field office and you can reprogram or reallocate them. We can help you through that process, and there's also a guide or instructions on the HUD Exchange to develop a disaster policy, which can also help streamline your process for reallocating or reprogramming. And then you can use those ESG funds even before, like if you have a subrecipient with a cash flow problem, they can incur the costs themselves up front. States and local governments absolutely have the ability to front their ESG money and then, provide that for their subrecipients ahead of time, and then their subrecipients have the funds available to use rather than using their own money initially and getting reimbursed for it. Part 200 says that you need to be providing those funds only basically minimizing the amount of time and providing it as close to the time that your subrecipient is going to be using them as possible. So you don't want to be giving them funding like weeks and weeks in advance or months in advance, and the money's just sitting there and collecting interest. That would definitely not meet Part 200 requirements, but if you can plan ahead, and we're also here to provide support to help you through that process, quickly get the funds out, and then subrecipients can use it with the least amount of time possible between the point that they receive the funds and the point that they're expending the funds.
Great, thank you so much, Marlisa. So we have a question, and I'm going to send this over to you, Brett, about homelessness prevention. So if a person was experiencing a housing hardship prior to COVID, but that hardship was exacerbated by the impact of COVID, can communities provide financial support to mitigate the hardship? If yes, under what circumstances? So I think this is probably being asked in the context of a homelessness prevention program. So can you talk about like how people should think about that sort of CARES Act requirement about being COVID related, to paraphrase very loosely, and how they should apply that in the homelessness prevention context?
Yep, so we're certainly hoping to provide additional information in the notice, but our general, where we're working to get is, or what we're telling people is that for now, pretty much every activity you're doing under ESG is going to be related to preventing, preparing for, or responding to coronavirus. If you're doing shelter right now, hoteling, moteling, that's deconcentrating your shelters. Most of our clients are also struggling with income right now because of a lot of the shutdowns and unemployment in businesses. So all of that's going to be related to responding to the economic impact of COVID. So to the extent that they meet the definition of at risk of homelessness, and keep in mind for CARES Act funding, they raised the income requirement for from 30% of AMI to very low income, which is generally 50% of AMI. As long as they meet all the other criteria of at risk of homelessness, they're going to be eligible for homelessness prevention. That being said, funds still aren't going to be enough to serve everybody who becomes at risk of homeless or homeless during this time, so you're going to want to work on targeting that assistance locally using local data.
Great, thank you very much. So we had a question earlier about the 24-month limit on, or extending the 24-month limit in the COC program on rapid rehousing, and they were asking about whether that could be applied to ESG as well. Could you, Brett, talk about like, well, could you just answer that question?
This memo the memo contains very few ESG waivers, except for the one that was going to immediately expire, because the notice that's coming out for ESG CV funds is going to give much more information about all of the statutory and regulatory flexibilities that apply to ESG CV funds as well as regular ESG funds. Obviously, if this waiver is on our list for COC, it's probably on our list for ESG, and I would say stay tuned for that ESG notice to come out. And we don't have a date for that notice yet. I'm sorry. That's the follow-up question, right?
It really is, isn't it? So, and I'll give the slightly longer version of that. We have obviously been working hard to get the notice out. We are 100% aware of how important it is and how the non-presence of that is slowing things down. We in the SNAP's office and in other parts of HUD are definitely working to get that out as quickly as possible. It's obviously not out yet. We will, make very big announcements when that comes out. I don't have a time frame yet, but again, we are trying to get that out as quickly as we possibly can. I also have another quick question I wanted to address. There was a question about, are there communities who already have their ESG CV funding? That means everything's been processed and they're actually, submitting and getting vouchers, getting reimbursed. And the answer is yes. We have many, I don't remember the exact number, but we do have many grants that are executed and people have started drawing funds. That includes both state and local recipients. Again, don't have the exact number, but it's clearly picking up the pace. So next I wanted to, had an interesting question, and maybe I'll take this one as well. But someone asked about whether there was, in follow-up to our discussion about the ESG formula, asked whether there was any chance that that new formula that was used on the second allocation could be used more generally from now on in the ESG program. I think Todd did a nice job of explaining that that it correlates much better with homelessness than the current ESG formula. I will say that that formula is written into our statute, so that would require a legislative change from Congress in order to change that formula. Obviously, they did that for the CARES Act. They gave us authority to use a different formula, but to use something like that going forward would require a statutory change. On the COC side, we use a very similar formula to do PPRN calculations on the COC side. Sorry, PPRN is preliminary pro rata need. It's the formula that helps us do some of the calculations of, for example, how much bonus funding you might get or planning funding you might get in the COC program. We did put out a notice a few years ago asking for comment on that. We are slowly working through creating a new formula for that program. So if you want to see some, I think, interesting discussion of formula options and issues, you could dig up that notice, and it had a lot of narrative about sort of different things we've been considering and looking at in a formula. So next I want to, let's see what other questions we have. Marlisa, I'm going to sort of give this question to you. Probably would have been better for Jessie, but she couldn't stay on longer. But this was in follow-up to the question about duplication of benefits. And the question is, for an individual unit or client or landlord, how would an agency or program know if the unit has already been assisted from a different program when they're considering whether they can fund it?
We have been trying to think through that process as well, because it's not necessarily easy, and I think we also expect that it's going to be pretty rare that that situation would happen. I mean, I know that one person made the suggestion or volunteered the fact that their community has a clearinghouse that identifies what costs are being spent on which activity to avoid duplication of benefits, but really it would involve, I think what you're asking would really involve a program participant or client wanting to access additional funds from a separate source and not directly get that benefit, but that benefit actually going to the landlord. So it would have to be a pretty nefarious situation where they're in coordination. So we're working through our documentation requirements. One thing that we have on the table right now is a self-certification, and that if a participant or entity, if a client or an entity receives a duplication of benefits and that duplication of benefits is identified, that they'd be obligated to repay whatever funds have been duplicated. So it's more on the back end that HUD would be able to sift through that and identify that, as opposed to the front end. But if there are other ideas for how grantees are doing this on the front end to prevent the duplication of benefits in the first place, it would be really great to know, and I think we'd be happy to share those more widely.
Great, thank you. And I want to stay with you for a second and ask a totally different question about, in the ESG program, there's currently a requirement that states have to obligate funds within 60 days of the date that HUD signs the grant agreement with the state. Is that going to be in effect for the CARES Act funding as well?
It's similar to the expenditure deadline. Recipients should just stay tuned for the notice for any alternative requirements or flexibilities that we're able to provide. So please stay tuned.
Great, thank you. So Brett, I'm going to throw this question over to you. This is about the at-risk definition. So obviously the CARES Act definition of at-risk of homelessness, the CARES Act changed the definition of at-risk of homelessness for the purpose of CARES Act ESG funding. So can you talk about what grants does that apply to? So does that apply to non-CARES Act ESG funding? And can you also talk about exactly what changed there? I think there are some nuances as to what changed in that formula.
Sure. So right now it only applies to CARES Act funding. The CARES Act obviously gave us flexibility to apply statutory and regulatory changes to normal ESG funding, but you have to stay tuned for the notice to see if we adopt it for regular ESG funding. So right now it only applies for ESG CARES Act funding. And then I think the easiest way to think about it is take the regulatory definition of at-risk of homelessness in 576.2, and the first paragraph has an income below 30% of AMI, and swap that out for has has an income below very low income, which is essentially 50% of AMI. The second test then is that they lack the resources and support networks to go to emergency or to prevent going to an emergency shelter or sleeping in an unsheltered location or going to transitional housing, and then meets one of 7 criteria. And then there are 2 other parts of the definition related to meeting another federal definition or being a child or youth who meets another federal definition. Those still are in place for ESG CV dollars. But for that first category of at risk, it's really just swapping out the 30% of AMI for 50% of AMI.
And one thing I would just add to that when we send out the allocation letter, we actually included a link to the HUD website that has the county level very low income data. So if you just go to that, and hopefully maybe someone could dig it up in the 25 minutes we have left in this call, but if you go to that website, you don't even have to do like know your AMI or 50% or whatever. You just have to identify that particular, find your county, and just, you know, that will have your income limits right there for you. So another question we have here about, so there's a question about documentation of disability, and so Brett, I'm going to toss this one over to you as well about documentation of disability and the mega waiver. So the question, and I'm just going to read the question, but the question is it correct to interpret that the disability waiver has 2 different expirations for different types of things? The staff observation expires on October 1st, 6 months after waiver release date, and the client self-certification is indefinite until the public health officials determine no additional measures are necessary to prevent COVID-19. Can you talk about, like, clarify how those parts of that waiver, what the timeframes are for those?
No, I actually think the questioner got it exactly right. There's the first part that expires in 6 months, and that's the part where the intake worker observes, and then you have 45 days to obtain the third-party documentation. That piece where you don't have to obtain the third-party documentation, where the intake worker certification is enough, that piece expires in 6 months from the date of the first mega waiver. And then the being able to take a client's own self-certification, that one expires when the public health official says no more special measures are needed.
Great, thank you very much. So another, Marlisa, I'm going to sort of toss this question over to you. So someone has a concern about ESG-funded agencies where they are allowing program participants to self-attest for habitability standards, and they have concerns about that. Can you talk about what is the actual requirement on habitability? Is client self-attestation or self-certification of habitability allowed? And how should people address some of these concerns?
Right now, self-certifications either by the program participant or the landlord are not permitted. So, so you are right to flag that for yourselves. I would say that to remediate the situation, it's a good idea to go back, and then you can actually work with your program participant who's currently in the unit, and they could do a virtual tour with you with their phone, or they could take pictures, or you could work out some way to go back. And then if for some reason you know they're not meeting habitability requirements, I think at this point it makes a lot of sense to sort of take it on a case-by-case basis, be in touch with your field office to see how, you know, if it makes sense to remediate, if the situation is really dire, you know, you may need to think through an alternate way to remedy the situation. But I would say just get in there to do your virtual habitability inspection as soon as possible, and also be in touch with your field office to make sure that you're sort of going back and remediating the problem.
And I might also add, and Erin might have something else to add, but this is a great time to make sure your emergency policies and procedures are very clear on what is allowed and that your subrecipients have copies of those and are trained on what is permitted so that they don't think that something is permitted and it's actually not.
Great, thank you. So we have another question here, and again, I'll read this question. Now I'll go ahead and take this one. But the question is, since there's a significant need for homelessness prevention and ESG CD funds are limited, is HUD planning to encourage COCs to apply for the COC program, to apply for COC homelessness prevention funds in the next COC competition? And is there any additional funding being considered for COC program rapid rehousing? So I think what they're asking for is given all the needs out there, should we be focusing on prevention first and then be looking at the COC program for rapid rehousing? So I want to talk through this a little bit because I think the question of there's a lot of money and there are a lot of needs. How do we sort of apply, how do we think through our needs is a really important question. I will say we did a webinar on Wednesday about homelessness prevention. I would very strongly encourage you to take a look at that. We did a webinar the previous Thursday on rehousing. I would also strongly encourage you to take a look at those because I think there's a question of do you do rapid rehousing and prevention, but there's also a separate question of if you choose to do one or the other, which of those, how do you do it well? Because even within each of those, there's a lot more need than we have funding for. So how should we think about that? But I want to talk about the way to think about this, or the way we're thinking about this, and the way I think, given the nature of COVID, given the risks going forward, what I think is a useful way to think about this. And I want to start by saying, different communities have dramatically different contexts. So I want to talk through that a little bit as well. So what we know about COVID is that it spreads most among people. The groups that are at high risk of COVID include Black and African American, Indigenous populations, other people of color, people who are elderly, people who have severe health problems, including people with respiratory problems. We do know these groups are all fairly significantly overrepresented in the homeless population. So, we see that there is a very high risk of continued spread among the people who experience homelessness. At the same time, the sort of conditions that lead to additional COVID spread are very much like a lot of people indoors in close proximity, like you see in some shelters with, shared sleeping areas and where there are a lot of people in close quarters. And even with social distancing applied in those shelters, we still see a lot of spread, certainly less than if we didn't apply distancing and other protective measures. But shelters are still an extremely high risk place for COVID spread. And then the other places where there aren't great sanitary measures and there isn't great opportunity to keep things super clean and wiped down. We see a lot of that in encampments, and so that's another very high-risk area. So I think, given the really severe nature of continued COVID spread and the dramatic impact on our communities, I think it's really, really important to keep our eye on the ball with respect to people who are in some of these congregate shelters and in encampments and other high-risk unsheltered locations. Now, in a lot of communities, they've done a great job of placing people in hotels and doing rehousing efforts, and so maybe that is a much lower problem in your community. And we do also know that there are a lot of people who are at risk of homelessness, and people want to do prevention to reduce that risk and want to keep people out of the homeless system for some of the reasons I just talked about. We talked a lot on that prevention webinar about looking for, where are those high-risk areas that you can apply prevention. that would be really helpful. We talked a lot about diversion programs. We had some great examples on the call of diversion programs. We talked about neighborhood programs that target certain neighborhoods that I think were really interesting. So I don't know if that webinar is posted yet. I imagine it will be posted in the next couple days if it isn't already. But I would strongly encourage you to look at those. But I also, I think people should keep their eye on the ball here. COVID is still a very severe problem. A lot of people are expecting a big recurrence in the fall. We're still seeing rising cases in a lot of states, and the homeless population is still very much at risk. So, I think before you sort of move on and think about other things, I would certainly want people to keep their eye focused there. So it looks like the prevention webinar will likely be up early next week, so stay tuned for that. Great. So let's take another question here. Let's see. Sorry, the problem with me answering questions is that I forget to tee up the next question. Oh, Brett, I wonder if you could take this question. This is another great question that's very related here, which is about using ESG CV funds for diversion. So this person has the question, we're hearing we should use ESG CV to support diversion. I think they just heard that 30 seconds ago. But how exactly do they do that? Is it best done through the shelter category? How would staff costs fit in there? What about, if they want to provide flexible assistance, can they use ESG CV for that? Or, what should they look for another source for? Should they get a coordinated entry grant? Like, how could they do diversion using ESG CV funds?
Yep, and Ebony and Marlisa certainly jump in if you have things to add. This is a topic that we're planning on providing more guidance about because it's not always easy to understand which requirements go to what and when is it easier to use ESG funds versus other funds. But yes, in general, you can use your ESG funds for diversion. And honestly, it just is going to come down to is the person homeless or staying in a shelter? Are the services related to a shelter? Could you go directly to using rapid rehousing? If you're going to provide short-term or medium-term rental assistance, that's going to have to come through rapid rehousing or homelessness prevention. So then it'll depend on whether the person qualifies as homeless or at risk of homelessness. So we would advise you to make grants to your subrecipients if you want them to do diversion activities that are flexible, that allow them to make those determinations and have funding in both pots. If they're staying in a shelter, they spent a night in a shelter and you're going to be using problem-solving techniques, you can fund that under case management through the emergency shelter line item, through the street outreach line item. If they're staying on the streets, you can provide some of the services, the legal services that are eligible in rapid rehousing if they're in a rapid rehousing project. So it's kind of all over the place. We do plan on putting out guidance that puts it all in one place, but the general rule of thumb is yes. Determine whether they're homeless and at risk of homeless, and then follow the regulatory requirements and any flexibilities that we're able to provide in the ESG CV notice. And if you think it's too confusing or not allowed, like right now, for example, well, this isn't related to diversion, so never mind. I don't have a good example in my head right now.
So Brett, actually somebody in the follow-up asked, can diversion funds be used, ESG funds be used for diversion to provide financial support to a host household if a person, if there's an opportunity to reconnect a person with family or friends? So can you talk about what would and would not be allowed there?
Yeah, Marlisa, do you actually, I feel like you have the best answer to this if you want to take it. If not, I can, but I feel like you have a better answer than I do.
Well, so a lot of there are devil's in the details, but yep. In general, You could use ESG rental assistance. I mean, it's not necessarily diversion per se, and I'm not exactly sure how you're using the term host. But if you did have a family member that had housing available, like a room available in their house, and they don't have the financial resources, they're not actually a financial resource or support network, you could potentially set up a shared housing situation and provide ESG rental assistance to that family member who is also renting out a room. So that is a possibility. I'm not sure if that's the example you were thinking of, Brett.
Yeah, that's the tricky part. And for ESG, if you're going to use it to provide rental assistance going forward, you're basically paying rent for a room in a house, and the lease requirements kick in and the habitability requirements kick in. So that's where sometimes if you don't want to go through that, at least right now, using another funding source to pay for that would be helpful. But then you could certainly use case management or housing mediation services through ESG to work through the mediation and resolve any issues and figure out what might be needed to move a person back in with that household. Yeah.
Great, thank you very much. And I will say people will be very interested in that guidance because we have a lot of follow-up questions about different things you could fund. So we will try to get guidance about that out to give people a sense of what they can and can't pay for. I will say that someone made the comment in the chat box that sometimes it is definitely helpful to have a non-ESG flexible funding source to help out with things because there are some that even if you can pay for it, like the documentation and stuff can be a little much, especially if it's a small amount. So definitely encourage you to think about how you can use a couple different funding sources together. Makes it much easier to use. I will also say we have a lot of questions that we can't really answer other than to say if it's something we're going to address, it would have to be addressed in the notice. And I think we've talked about that we're working on the notice, but it's not out yet. So if you've asked a question and we're not answering, the likely answer to that question is that we are, it's in the note. It's something that if we want to address it, it's going to have to be addressed in the notice. And so stay tuned for that. So sorry, we don't have more detail about a lot of this stuff. The one question I want to send to Marlisa, somebody has a question about tracking time on ESG activities and whether time spent on sort of the normal ESG project has to be tracked separately from, it's not clear to me if they're asking about based on the grant or based on the activities, but whether whether you have to track activities separately if they're normal ESG activities versus CARES Act activities. So can you talk about that first in the context of a program that gets two different grants, one from sort of say their 2018 ESG grant and then their CARES Act grant? Are they going to have to track activities separately for each of those funding sources?
In general, you should treat your ESG CV grant and tracking costs such as staffing the same way that you would distinguish between staffing costs that are paid for separately, separately from like a 2018 grant versus a 2019 grant. So I think in most cases, providers and recipients are not requiring that like individual shelter staff, for example, are switching between time that they're being paid for under their 2019 grant versus their 2018 grant. Similarly, we would not expect that staff are saying, okay, now I'm working under my ESG CV grant and now I'm going to switch over to, getting paid under the 2018 grant. So that level of detail and tracking is not required. You do want to consider, though, if you're funding an activity that's currently only eligible under ESG CV. So just be aware of any flexibilities that are only applicable to ESG CV, and then you would want to make sure that you're only paying for it with ESG CV funding. So you would want to set up that sort of structure to separate those types of eligible activities out. But otherwise, you would just treat the tracking of staffing costs the same way as you're typically doing it now. And then also, in case you're looking at this from a different perspective, you know, in IDIS, just a reminder that we do require grant-based accounting. So you just need to make sure that you're keeping your 2018 funds tracked separately from your 2019 funds and so on in the system. Even if you happen to reprogram them for a different use and want to use them currently, you still just need to keep them in IDIS as, you know, under their respective federal fiscal year grant.
And so the related or somewhat related question, Marlisa, is, so let's take, you have sort of your normal ESG activities, so the things that are always normally allowed under ESG, and then you have sort of special activities that are allowed because of the CARES Act. Can you talk about, do you have to, obviously those are allowed under a CARES Act grant, do you have to track those sort of special CARES Act activities separately from your normal ESG activities if it's all funded out of a CARES Act ESG grant?
So I'm trying to think specifically about the scenario that you're describing, Norm. And so you're saying if you're doing like temporary emergency shelter under your CARES Act grant, do you have to track it separately from the rest of your ESG CARES Act activities?
So that would be one example, absolutely.
Okay. Well, so there are two ways of looking at it. There's, you know, financially speaking, and then HMIS wise. And we are going to be having guidance coming out in short order that will explain exactly how you want to categorize you know, these special activities under ESG CV, which will also make, I think, a lot more sense once the ESG notice comes out. Right now in IDIS, you know, it's a very, very high level of tracking. So you're going to just keep exactly to the way things are right now with your 5 different component types. So you don't need to track it separately in IDIS, but we'll basically be providing additional guidance for these special activities and how to categorize them and under which component they will fall, both for HMIS and for on the financial side.
Great. Thank you, Marlisa. That brings us about to the end of our time here. I want to thank all our presenters. Todd and Jesse hopped off, so I'll thank them by email, I suppose, later on. But I also want to thank Errand and Brett and Marlisa and Ebony for answering a bunch of questions. There are a whole bunch of other people involved in that as well. I want to thank Natalie and the team and everyone behind the scenes making this all work. And again, want to thank you all for your incredible work here. I know there's a lot going on, which is the biggest understatement I think I could possibly make here. And we're still, you know, moving forward and doing great work. So we definitely appreciate that. We can definitely see the difference you're making, and we definitely want to help and be supportive wherever we can. So thank you so much, and I hope you all have a good weekend, and that concludes the webinar.